Health has been in the eye of another intense political storm right through this week after a spate of horror stories from hospital emergency departments in Sydney prompted both sides of federal politics to talk of intervention, but in very different ways. Health Minister Tony Abbott says the answer lies in reviving the appointment of local boards to up to 750 public hospitals around Australia to make them more accountable to their communities. But opposition leader Kevin Rudd says the national health system needs a massive funding boost, and if the states then don't deliver results, the Commonwealth should take over. Some health experts say neither major party has got it right yet. Deborah Cornwall reports.
Here's my wife sitting on a toilet screaming, and with a look on her face I'll never get out of my mind, holding a live fetus between her legs with blood everywhere. And me looking at her, looking at the fetus moving in a state of absolute, shock, and you cannot believe that this would happen in our country.
The plight of Sydney woman Jana Horska, left to miscarry alone in a public hospital toilet, is only one of a litany of horror stories that have emerged from public hospitals in recent years. But on the eve of a highly charged federal election, it was one failure too many, with health experts saying it finally catapulted public health onto the national agenda for the first time since the Howard government was elected more than a decade ago.
It's been encouraging to hear some debate about health, because for years it seemed to have dropped completely off anybody's public agenda. But I think we're badly out of practice.
Prime Minister John Howard made the first strike 2 months ago with his highly controversial move to take over the small Tasmanian hospital, the Mersey.
Hello there.
Then this week, in the wake of the Jana Horska affair, the federal government weighed in again, blaming the crisis in emergency care departments squarely at the feet of state government and faceless health bureaucrats, and calling for more direct community involvement in hospitals with the return of local boards for some 750 hospitals across the country.
The problem at the moment is that in many of these institutions the management is not really accountable to anyone.
The plan was immediately howled down by state premiers across the country, who pointed out community hospital boards had been systematically disbanded over the past 30 years. Health administrators are also underwhelmed and unconvinced that local boards could manage the demands of a modern health system. What do you make of this proposal?
It really is quite nonsensical. Suddenly say, oh, and by the way, we're going to bring back boards for each of those small hospitals. I mean, this is a bit like saying, no suburb should be without its village glee club.
I would welcome the concept of reintroducing local governance, a circumstance where the people who run the hospitals have to pay attention to what the local community is saying, but the detail within there needs to be looked at before you can sort of really sign off on it.
It can be among the most forbidding and bewildering moments of our lives. Whether as a patient or a visitor, it's usually a time when we're at a low ebb, at a time when we're most in need of help.
Professor Leader says it's easy to get misty-eyed about the kinder, simpler days of the 60s and 70s, when public hospitals were at the very centre of our communities and hospital boards were at the height of their powers. But highly sophisticated medical care is today keeping more of us alive and for longer, and that means more complex management challenges and a lot more beds.
And people wonder why the emergency departments don't work well. In large part, it's because they have nowhere to put the patients, because the hospital is full.
There is a daily pressure in which you know that you are incapable, despite your best efforts, of delivering the service that so many people need.
Staff that remain in emergency departments across Australia are highly dedicated staff. They work in incredibly stressful, busy, overcrowded and difficult environments. There's increasing violence in emergency departments, so staff are often assaulted, verbally abused, and staff really don't get the backup that they need from the rest of the system.
I'll work cooperatively to get our hospitals fixed.
Opposition leader Kevin Rudd has promised to inject $2 billion into public hospitals if elected. But after a decade of chronic underfunding by both state and federal governments, Federal Health Minister Tony Abbott today countered with yet another bid.
I think that people can take it for granted that the Commonwealth Government will increase public hospital funding over the coming 5 years.
The wealth of Australia, good gracious me. I mean, we are at the top of the pile globally, economically, and yet here we are saying, oh no, I'm sorry, we can't afford to provide more public hospital services because we've got to give money back to the taxpayers. I mean, hello.
Deborah Cornwall with that report. Tougher guidelines to try to curb drug